Hello, I'm Jawad Hussain. I'm the Executive Medical Director at East Lancs Hospital NHS Trust. This is my update on the week beginning 1st of August 2022. I'll start with what's currently happening in the hospital in the sense of there is an ever increasing numbers of patients being admitted with COVID, and last week we saw the numbers going as high as 113 in the hospital, and as a consequence we had to open up a couple of wards more than what we had for just COVID patients. We unfortunately also had patients with COVID in intensive care. Now, you probably will recall from my previous updates that it had been a long time that there was no patients with COVID in intensive care. And at one stage last week, we had 5 patients with COVID in intensive care. 3, although were incidental, 2 had come in with symptoms of COVID, and as a consequence of COVID, were admitted into hospital. Thankfully, no harm had come to the ones in intensive care, but the concern still remains of the increasing number of transmission of this virus in the community. Hence, our emphasis still remains on please follow the IPC principles. As you will all remember that a few weeks ago, we brought in the measures of wearing masks in all areas in our hospital, whether it's clinical and non-clinical. If we don't bring in those measures, the number will go up further. The nosocomial outbreaks in areas have also gone up, and again, that is down to transmission of the virus. So it's so essential that people gel their hand, they put the masks on, and if possible, try some social distancing. I know it's not possible and we've not asked for it, but the viral transmission does rely on close contact. So follow the IPC principles and we'll hopefully have less transmission between individuals. So that's with the COVID numbers and the activity. Soon, NHS is going to start with the booster dose. For some of you, it will be the 4th COVID vaccine, meaning by that each individual, most of the individuals actually would have had 2 shots of COVID vaccine, which was then followed by a boosted dose. That was the first booster, and hence in autumn it will start with the second boosted dose. At the same time, we would be offering flu vaccine, and our request and plea to all is that if you are offered, please do take that up, because flu also, although may sound a very benign type of a disease, but unfortunately people die of flu. Hence the importance of having that vaccination along with the booster dose. Pressure still remains in our A&E, and again last week at one stage there were a significant number of patients, which then, as you can imagine, results in difficulty in providing the required care. But again, credit to the teams, they've worked well and have managed to keep the patient flowing through A&E into the hospital and then out of the hospital to the relevant place. And with that comes the ask, why not home, why not today? The whole aim of that is to emphasize that care provided at the right place is so important for individuals. Hospital is a right place for people who need an input, but the moment that input and treatment has been delivered, there are much better places to be other than hospital, and that's at times is a bed in the community, and most of the times is the care at home. So please work with the teams to ensure that the moment you are ready to be discharged, then the loved ones and the individuals are prepared to get the patient out of the hospital into the care setting that is essential for them. And with that, I'll bring an end to the briefing today. A big thank you to all the individuals and colleagues who are working in hospital and in community teams to ensure that we continue to provide the safe, personal and effective care that our values and vision holds. Bye for now.